I just want to be clear. The patient that have a doctor right now, a GP, will keep it. We are negotiating with the doctors. That's period of negotiation. I just want to reassure Quebecers, nobody that has a doctor will lose it. We're going to publish over the next few days the mandate that the Treasury Board have negotiated so far. I will be very clear.
The code of color is there.
It will be explained very well what will be the negotiation.
All right, that is Christian Dubé, of course, the health minister, reacting to the story that some people pointing out that in the midst of these negotiations with doctors, one of the things that came up, which he says at the beginning right there, not to worry, that nobody is going to lose, right now, the way things stand, nobody is going to lose their doctor. But from what we understand, the government has been pitching this idea of something like a color-coded system, which seems to prioritize patients. It's trying to find out more. Dr. Samer Daher is on the line. He's a GP and president of the Montreal Association of General Practitioners. Doctor, thanks so much for being here. Can you recap for us what has been presented to you? What is this whole color coding thing all about?
Well, they tried to present that same color-coded priority for patients a few months back. And we said, absolutely not. We're not going to work like this. Doctors are there to treat patients. If I have a load of 2,000 patients, I'm not going to tell 1,000 of them, I'm sorry, guys, but hey, you don't need a family doctor. I'm going to take others instead of you. Now, that's a big problem because they came back again with an offer that contains the same color-coded distribution of patients. I don't know who's going to triage them, distribute them like this. We have no idea, but probably some civil worker in Santé Quebec or Minister of Health to decide who's going to be having a family doctor and who's not. So it's still unacceptable. If it was unacceptable by the government or by us and the National Assembly in Quebec voting against it, I don't know why it would be acceptable today. So, no, we're not accepting that.
Let me ask the question. When I saw him say no one is going to lose their doctor, I thought to myself, after I'd read about this color coding, that sounds to me like if you have a doctor now, great, you get to keep it. But as the system keeps going, that's where we're going to run into problems as to who gets a doctor and who doesn't. Is that accurate, do you think?
It's exactly how it is. Because right now we have a lack. We used to have a lack of 1,200 and 1,500 general physicians. Now it's 2,000 family physicians. The lack of family physicians in Quebec. How, instead of finding solutions on why doctors are leaving this profession and going somewhere else into other specialties or leaving the province or going into private, they try to solve their issues by putting all of that on, first of all, the patient, telling them, you cannot consult with a doctor, but yes, you can. That is not going to work like this. And on the other side, blaming doctors for the shortage. I'm sorry, I'm not responsible of those bad policies of the Ministry of Health over the past 22 years. I mean, I'm a doctor, but I'm a patient too. I have a family doctor. And I would be categorized as green. Would I accept today at 56 years of age to be told, hey, sir, I'm sorry, you don't need a family doctor, someone else would need. What if I have symptoms and I'm sorry, and practitioner or nurse has her limits into diagnosing things. We all know that, and they all know that. What if I need a doctor and I get told, no, you cannot? Would you accept that? I wouldn't accept it. Why should I accept it for my patients?
How does it work? The system now, so the red, green, yellow, the idea being what? Did they break it down as to how it would work?
Well, they said that the INES, Institut National en Excellence en Santé, whatever, had worked this system, and you can take a look at it. Quite frankly, I didn't look at the details of it, but I'm not going there. I don't want to even consider it. What I have a bunch of patients that I need to be present for, and I'm present for other patients who do not have family physicians, but we're not going into color-coded. Because eventually we know that it's going to lead towards us being obliged on telling our patients, I'm sorry, but you're green, so no, you're going to be seeing the nurse, not the doctor.
Right, and that's sort of the issue as well, right? You could be with a doctor now, but then depending on what it is you have to do next, they send you somewhere else, so you lose that whole relationship with your family doctor if they decide you have to go see a specialist somewhere else.
This is what we're telling them.
Okay.
Yes, I mean we work with clinician nurses here. We have a lot of other professions, but we work as a group. We don't tell our patients, no, go see someone somewhere else. The cases that are lighter are seen by my nurse, but if they complicate, I'm next door. She knocks on my door, and I take over the patient.
Where, with respect to the negotiations, because he did mention that the clip from the health minister talked about the fact that there's still negotiations going on. Where are we in the midst of all that? Do you know?
To tell you frankly, it's very discouraging because we're not far advanced. Our deal has been expired since March 2023. We're in almost May 2025, and there are no advancements. Mm-hmm. We propose so many solutions to change the way we treat patients, to change the way we provide health services, to improve the visibility of family physicians, of family medicine. And so far, all we get is insults, and quite frankly, I'm just sick of it. It's really annoying. It's really insulting the way we are treated as physicians. All we want to do is treat patients. We don't want to go into politics. This is not our game. I studied to be a doctor, not a politician.
And of course, as you're describing your frustration, we know that at the same time, so many doctors are choosing to leave this province for one reason or another. And I guess some of it is the frustration over what you're describing. So it's only making the situation worse.
Exactly. I put myself in their shoes. If I was 25 or 30 starting my career with all these rules and regulations that are imposed on Quebec physicians, I would definitely choose another province. I'm not going to do it because I've been here for 31, almost 32 years working as a family doctor. I have my patients, I have my family, my friends. But young doctors, would you blame them if
Sure.
they decide to? I wouldn't blame them. It's annoying. It's really hurtful because I need family doctors to take over some of my patients because I need to reduce my practice. I cannot, for the past 4 years, I was not able to recruit a single family doctor into my clinic.
I wonder if the situation, as you mentioned, I think at the beginning, was simply a matter of, we know we're short doctors. We've been looking at the same situation now for years. What's the government's argument, as far as you know, for simply saying, you know what, let's just get more doctors? If it's a matter of, is it a matter of we can have the money to pay them more? What's the rationale for not going out and doing this?
Let me put it that way. The rationale of money. One doctor seeing 40 patients a day, or two doctors each seeing 20 patients a day, that's exactly the same pay. Because we don't have bénéfices marginaux, I don't know how to say it in English. Mm-hmm. What we get is a lump sum. We do buy our own insurance. So why are they still saying that you have to work double and triple? I don't want to work double and triple. I've been doing that for the past 31 years. Just bring in new doctors. And in order to bring in new doctors, you have to change this attitude of being forceful on doctors and telling them, no, you have to do this and you have to do that. Sorry, doctors are 9,000. Family doctors in Quebec, we are 9,000. Health professionals in Quebec, 190,000. So why is this responsibility only on family doctors? Where are the psychologists who would see our patients? Why do I need to play as a psychologist and do a psychotherapy for my patient? Because the psychologist is not available. Yeah. Why do I need to deal with the dental abscess if the dentist is not there?
Understood.
Everything is coming towards the family doctor. Hey, let everyone be available at the same time, and then we'll discuss the other issues.
Doctor, we have to wrap it up there. I do thank you for your time, and I hope there is some movement forward on this issue because, as you're describing it, it's a situation that's bad, and it looks like it's only going to keep getting worse. Thanks so much for your time.
Thank you.